Hi everybody, my name's Melissa Koehl. I'm a physical therapist and Pilates instructor. Today we're going to talk about the transverse abdominis muscle. The transverse abdominis is your deepest abdominal muscle, and it has horizontally oriented fibers, so when it contracts it creates like an internal corset to give your spine stability. This muscle is really important to know about because it can be helpful for preventing back pain and also for management of back pain. If you're having an acute episode of back pain where you're having quite a bit of pain and there aren't a lot of movements available to you at that moment, doing a nice gentle transverse abdominis contraction can be really well tolerated by a lot of people because it is so gentle and it doesn't create a lot of compression in the spine. It also has direct attachments onto the spine through the thoracolumbar fascia. So in that regard, it's the only abdominal muscle that has a direct influence on your spinal stability at that very deep level. You can do this in a number of positions. What most people find to be comfortable is to start laying on your back. But we'll do some other positions as well if laying on your back is not good for you. But what you want to do is get into a hook lying position with your knees bent, feet flat on the ground, about hip width apart. And then start with some easy pelvic tilts. So you're just going to take a breath in, and then as you exhale, tilt your pelvis backwards so that you're flattening your spine down onto the ground, and then inhale to tip your pelvis forward. And then just go back and forth, exhale to tip back, and inhale to tip forward, just to get some gentle movement in the spine, and you can do a little assessment on yourself to see what position feels best. In general, for most people, somewhere in the middle, and that is your neutral spine position, is the most comfortable. But there are some certain back conditions where you may want to be in, slightly more of a tilt one way or the other, depending on what's going on with you that day. Either way, explore a little bit, see what feels like your most comfortable neutral position for that day. Once you're in your neutral position, you're going to take a deep breath in, filling up your lungs and letting your ribs expand. And then as you exhale, let the breath all the way out, and then you're going to pull your belly button in toward your spine. It's like you're going to imagine like the front of your pants are a little bit too tight, and you're just pulling the skin away from your pants a little bit. It's not too strong of a contraction when you do it right. So what I find is really helpful for people to know if they've got an isolated transverse abdominis contraction, it's to know what it feels like when you do too much, when you activate the other muscles that we're not trying to work at this moment. So for example, if you take a breath in, and then when you exhale, if you tuck your chin and do like a little crunch, a little sit up, you'll probably feel your stomach muscles start to push up toward the ceiling. Especially if you put your hands on your belly, you can feel the abdominal muscles push into your hand. And so that's your rectus abdominis, your obliques kicking in, which is fine for strengthening those muscles, but the purpose of what we're trying to do here is just activating that transverse abdominis. So when you do it correctly, you won't feel the muscles pushing up and bulging up toward your hands or toward the ceiling. In fact, you'll feel the opposite. The abdominal muscles will pull inward just ever so slightly. It's almost very similar to like a pelvic floor contraction, like a Kegel, if you know what that is, or most of us can relate to if you've ever had to wait in line to go to the bathroom and you have to hold it. That's, in general, your pelvic floor contraction. So if you can get a pelvic floor contraction lifting up, and then think about that same kind of deep lifting motion happening in your belly, that'll be your transverse abdominis kicking in. So we'll try it again. Take a breath in. Expand the lungs, inhale, and then fully exhale, and then start to pull the belly button down toward your spine. Once you've got that contraction, you're going to hold it for about 10 seconds and see if you can continue to breathe in and out of your rib cage. Let's try it one more time here. Breathe in. And then exhale. Slowly pull the belly button in toward your spine and hold for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then relax. Good. So once you've got that, you may want to pause and do a few rounds to practice. In general, you want to get to 10 sets of 10 seconds. So once you learn how to do that muscle contraction, the next thing to do is to try to move the arms and legs while keeping the core tight, keeping the transverse abdominis contracted, and keeping your spine neutral. So the next thing you can do is some small arm or leg movements. So for example, you would take a breath in, exhale, draw the belly in, and then keeping your spine in that neutral position, see if you can lift one knee up off the ground in a little marching motion, and then slowly let that foot down. And then I would just go back and forth on that same side to start. And you'll feel your body is going to have a tendency to want to rock back and forth here with the movement of your leg. So the trick is keeping your deep abdominal muscles tight, keeping your spine neutral as you're moving the leg. And so this is what it will look like on the other side. So breathe in, exhale, pull the belly in, and keep the ribs connected to the pelvis. I'm going to float the right knee up. Exhale, bring it down without moving my back. Inhale to bring it back up. And exhale, slowly bringing it down. One more time. Up. And exhale down. Good. We also can do that with the arms. So we'll breathe in and exhale. Pull that belly in, just imagining that internal corset supporting your spine as you float one arm up overhead without moving your upper back or your rib cage. And then exhale to bring it back down. Let's do two more just on that side by itself. And here you'll see the ribs want to flare up a little bit. You're going to use your abs to hold the ribs down and let the movement come just from your arm. Inhale and exhale. And then let's try the other side. Okay. Left arm floats up, rib cage stays glued to the floor. Exhale on the way down. Inhale as you reach up, keep your shoulder blades nice and low from your ears. Belly button pulls in toward the spine the whole time. Exhale. Inhale, reaching up. And exhale to bring down. Good. Once you've got that, there's a lot of ways that you can make this more difficult. You can start adding one arm and one leg at a time. Inhale on the way up. Exhale on the way down. And really focusing just on keeping your core stable. Most likely you know how to move your arm and your leg. That's not really the challenge here. The challenge is keeping everything steady, even though we're adding in some movements of the rest of the body. Inhale. Exhale to come down. Let's try one more. Up we go. And exhale. Good. All right. So the next position we want to try this in is hands and knees. If you have any sensitivity of your knees, you can always do a small towel or pillow under your knees. You're going to have your hands just underneath your shoulders, knees underneath the hips. Find a flat back position. We're going to let the back extend and let it round just a couple of times, just like we did laying on your back, to find your comfort zone, find the amount of motion that you have available at this moment. Exhale as you round. Inhale as you come back up. Just go as far as you comfortably can. If you feel stiff and like you want to stretch, you can go ahead and stretch to your maximum. If it feels like something's a bit painful, you can stay just within the range that feels good for now. So again, find your comfort zone, find that neutral back position. Take a full breath in, open up the lungs, and then exhale. Let your breath out and slowly pull the belly button up and in toward your spine. As you're pulling your belly in, you can imagine like your arms and your legs are pushing down into the floor to give you a little more support. You're going to hold that for 10 seconds. Head in line with the rest of your spine. Checking that you're still breathing in and out of your rib cage, and let it relax. If your wrists are a little sensitive, you can sit back on your heels and give them a little shake, circle them around, or even sitting in a little child's pose sometimes feels nice. And then we'll come back up. So just like the laying on your back version, just starting with this, do 10 rounds of 10 seconds. When you're ready for a slightly more advanced challenge, we start adding the arms and legs. So we'll take a breath in, exhale fully, draw the belly button up and in, push the floor away, and we're going to slide your left foot straight back behind you without moving your back. So we're just going to slide it along the mat, keeping your big toe on the ground. Hold it here, pull the belly in. You'll probably feel all the muscles in the back, your back extensors, your glutes, your hamstrings start to fire a little bit in this position. And then slowly bring that side back in. Take a breath in. Exhale, pull the belly up and in, and then we'll slide the right foot straight back. Keep your spine long as you continue to breathe and bring that side back in. All right. And we can also do the same with the arms. So inhale, exhale, pulling the belly in, keeping your spine stable, and then we'll lift the left arm, first just by sliding it along the mat. And then if you have the strength to lift the arm up, you lift it up. Bring it down. And then try the other side, keeping your spine neutral, belly lifted, slide the fingers forward, lift the arm up, bring the arm down, bring the hand back under the shoulders. And then if you're ready, you can try opposite arm, opposite leg at the same time. Inhale, exhale, draw the belly in, slide the right toe back, slide the left hand forward. If you're able to lift your foot up off the ground an inch or two without moving your back, pause and hold it here. Down. Take a breath in. Exhale, pull the belly in, slide the left foot back, slide the right hand forward, and lift. Bring it down, and then sit back on the heels, give the wrist a little break. Now, the last position that works for a lot of people then is doing like a little mini plank. So if you felt pretty good in the hands and knees, you can also walk your hands forward a little farther away from the knees, lean your body weight until you come into a modified plank on the knees. Still, right here in this position, you can feel lots of good ab activation, your back extensors are working, your shoulder stabilizers are working. Continue to breathe as you hold the belly in, and then sit back on the heels. If the wrists get a little sore, you can do a version on the elbows. So we would just come to the elbows and the knees, walk your knees out, and then start to drop your hips forward. You're going to keep yourself a really straight line from your head down to the knees. Belly button lifted, and hold. Hands straight ahead, about shoulder width apart. You can do palms down, or you can do thumbs up. Pause for 5 more seconds. 4, 3, 2, 1. And then we can come all the way down. All right, so that gives you a few ideas on how to activate your transverse abdominis muscle. You can also do this in other positions. You can do it in sitting, you can do it in standing. Ultimately, as you get more practice with it, it should be happening automatically while you're doing much more complicated movements throughout the day. But this is just a simple way to get it active, especially if you're having an episode of back pain or you're wanting to get some more nuanced motor control over what's happening in your abdominal muscles. This is a really simple basic way to start with that. So I hope you found this video helpful. Please let me know if you have any questions, and thanks for watching.